Okay, we are live, and it looks like we actually have been for a couple seconds here. How are you doing today, Dr. Gerdolle?
I'm fine. Thank you. I'm very good. Thank you for having me. I'm very happy to be here.
Absolutely. All the way from Switzerland. And one of the things I wanted to mention was, Doctor, you were going to be our keynote speaker at our 2020 conference. And unfortunately, as things panned out, everything got delayed. So we're happy to have you now and very appreciative of that. So thanks a lot.
Yes, I'm also very, very happy to have that kind of compensation. You know, the frustration was so big.
I know. So many people wanted to hang out and get to know you in person, and we're excited to see your presentation and learn from you. So this is going to be a small glimpse, I think, of what you had planned for us.
Yeah, because I think that initially was like a 3-hour lecture, and the webinar will be only 1 hour, so we'll have to shorten everything a little bit. But I think it's the main point can be discussed anyway, so it will be okay.
Perfect. What I'd like to do now, if it's okay with you, is share my screen and jump onto our website for the Academy and just kind of review a few things that you might be discussing.
Well, my pleasure.
Do you see my screen now by chance? Hopefully you do.
Yes, now I can see it perfectly.
Perfect. So this is our website and our registration page. I just wanted everyone to know, if you go to the Academy of Biomimetic Dentistry website, there will be a little tab at the top for webinar and a bar at the bottom that says register. If you click on that, it will take you to this page, which explains what we're going to be, what Dr. David Gerdolle will be discussing and covering on his upcoming webinar. And you'll be able to register for the upcoming event on November 14th, 4 p.m. Eastern time. So at this time, Doctor, I'd like to just kind of turn it over to you a little bit and just give me some highlights of what you're going to be discussing, so people can see if this is of interest to them or not.
Well, the topic of the presentation is about the use of the rubberdam in restorative dentistry mainly, and also prosthodontics. And this is in fact a very old and a very basic technique. And the aim of the technique is to try to be a little bit cleaner, avoiding some contamination with bacteria and stuff on the teeth we are taking care of. And the second point is, when we are doing minimally invasive dentistry, it is supposed to use some hydrophobic products, resins, composites, and those composites, they have to be used in a very dry field. So the rubberdam is also put from the beginning of the treatment for that purpose. But for sure, for a couple of months, we have a third indication, main indication for the use of the rubberdam is to get protected from the COVID. So for the dentist and the team to be protected, and also for the patient to be protected. So it looks like it's now a very hot topic, because it's a way to be safer, cleaner, and more efficient in our minimally invasive dentistry. So this is mainly what it is about.
Perfect. So if anyone is interested in learning more, it sounds like not only can this help with your biomimetic, techniques and dentistry practice, but there also seems like there might be a business aspect to this as well, if applied to the business side of things as well, which is really great, because people want to be safe when they're coming to the dentist, right? So if they know that, that could probably help them out.
Exactly, and I think it's also very important for the patient to know that the dentist is using the safest technique, not only for the teeth, but for its global health. And this is also very interesting to mention, and for the patient to know that. But in fact, this is not a new technique. For more than 150 years, it has been used and promoted. And this is really the base of the pyramid in dentistry. But I think that now it's even more important to be aware about those techniques that is not so easy to use. This is the problem. This is not so It's pretty demanding, but I think that it can produce a huge difference in terms of quality for the care that we are doing on the patients, for sure.
I guess a couple questions that I could bring to the table would be, is this type of dentistry that what you're going to be presenting, is it widely known, or is there many people doing it? And why would this be of interest to a biomimetic dentist to attend the webinar? What would be there for them to learn?
Yes, I think this is a very good question. This is a very good point, because some people say, okay, those guys, they are pretty strange. They do dentistry that nobody does, but this is exactly the contrary. This is the basic dentistry. We are discussing about, simple decays, fillings. So this is very the routine every single dentist has got to do in his office. The way it is different is maybe the way it is done, because it's not only about filling a cavity only with a composite or something in a very quick way, like in 10 minutes, but being able to achieve a different protocol just to make sure that this filling will be the best it could be and the less invasive for the tooth of the patient. So in fact, this is really basic dentistry, nothing special at all, but the protocol that we will just use for this biomimetic approach, it's a little bit different. Maybe it's not the usual one that the majority of the dentists are using, just because it's a little bit more time consuming, and maybe you will do a little bit less money using that protocol, but that's okay.
So you have to give me a little cliffhanger, or a little bit of something that I'm gonna hold on to, that you're not going to tell me what it is and why I need to attend this webinar. What are you going to tell me that is unique and different, that's going to be mandatory for us to attend?
Well, I could mention two major reasons. The first one is a very classical one. Let's say it's like, we just have, or we should provide the best care as possible to the patient, because it's our responsibility, and we should give them the dentistry we would like to give to our children or our relatives. So we need the best protocol for that. We need the safest one. And using the rubberdam is really raising up the quality of what we are doing. So no discussion. If you want to do that to your son, you will do that using that protocol. So why not for all the patients? This is the first reason. And the second reason is a very, I would say, a personal reason. It's something related to the well-being of the dentist, the excitement he can have to do his job, because this basic dentistry, as I mentioned, can be very boring. I've been a dentist for, I don't know, 28 years from now, and putting fittings in the teeth for 28 years. But what's the point? How can it remain exciting and really something nice to do? And this is the other reason. If we change a little bit the protocol, if we try to do it perfect, to do it clean, to do it right, it provides such a pleasure, such an excitement to the dentist that it will change your day. It makes every single very simple case into something very interesting and very exciting. And so I'm not ashamed to say that I am trying to do this dentistry the best I can for my patients, obviously, but for me too. This is just also my pleasure, and it's a great way to raise up the pleasure, as you never could imagine, because we are working in a very dark place. It's like you cannot see anything. It's full of saliva or bad smells, and who wants to work in there? Nobody. And after 10 years, you get mad and you want to commit suicide. If you put the rubberdam, it is just completely different. It's like, it's just wonderful, clean, smells good. You can do it perfectly, see it perfectly. It's another world, simply another world, another job.
Wow. So I'm not a dentist myself, but I know a lot about this subject. And from what you're telling me, this sounds like a no-brainer, right? Sounds like something that you have to do.
You have to do, you have to try, because the reward is very high. At the beginning, we only see the efforts, and they say, okay, it's different from what I'm doing usually. It's demanding, so it's difficult. But let's say that, as always, the more effort you put, the best the reward would be. And it works also with these techniques. So this is simply something really fantastic. For now, I could tell you that if I had to pay to be allowed to use the rubberdam, I would pay. I would even give some money to the patient for him to allow me to use the rubberdam and to do my job in the conditions I would like to do it.
That's funny because it makes your day that much more pleasurable.
Yeah.
Well, doctor, I really look forward to, we're just a few weeks out from your webinar. Hopefully everyone watching this video will join us. I thank you for your time today. Are there any last minute parting words you would like to share with any Academy member that might be watching right now?
Well, it's really a pleasure to work with those guys, because I think that we are sharing the same philosophy, but it's far beyond philosophy. You know, it's not only about teeth. It's something that is really, for a couple of years now, a very close friendship, and this is why also I'm doing it. You know, this is about sharing everything. It's not only about teeth, because teeth can be very boring. It's the human relationship that is beautiful, and with these kind of great people, I think that is more than having common points, common view, common philosophy. It's really to share so much, and this is what we are trying to do also with the people that are attending to the presentation. I see, to establish that kind of contact, and it recreates something different. This is why when they ask me, okay, would you like to do that? Yes, obviously, I do want to be part of it. Yes.
Great. Well, thank you for your time. Have a great weekend, and we'll see you in a couple weeks.
Thank you for the opportunity. Thank you for your trust, and see you very soon indeed. Thank you.